Welcome to the 8th Digital Dialogue in the series convened by WHO and UNICEF. My name is Afrouz Kaviani Johnson. I'm from UNICEF's headquarters in New York. Let me just note that we do have AI-enabled interpretation and captioning available for the webinar, and the webinar is also being recorded to be shared with all registered participants following the webinar. So we're absolutely delighted to be convening the 8th Digital Dialogue. Today's dialogue builds upon the momentum from the Bogotá Conference, really focusing on those commitments to provide response and support services for children who need them. We're delighted to have Dr. Etienne Krug, the Director of the Department of Health Determinants, Promotion and Prevention of the World Health Organization, and Ms. Shima Sengupta, the Director of Child Protection at UNICEF, to open our dialogue. So over to you, Etienne.
Thanks so much, Afrouz. Good day, colleagues from member states, practitioners, civil society, survivors, young people, and all partners. Welcome to this digital dialogue where we're going to discuss response and support services for children that suffered from violence. And a big thanks to our friends in UNICEF, Afrouz, Shima, and all colleagues for co-hosting this digital dialogue with us and our long-standing excellent collaboration. It's been a while now, but when I worked as a medical doctor in countries as diverse as Belgium, Mozambique, or El Salvador, being confronted with children victims of violence was a very regular occurrence. And my university studies certainly had not prepared me well for that. My daughter, who works as a pediatrician in Switzerland, tells me not much has changed, unfortunately, on that front. These health consequences that children suffer are diverse: physical injuries, sometimes leading to disability, mental health consequences such as depression, anxiety, PTSD, or harmful substance use, and in the longer term, increased risk of NCDs, cardiovascular disease, or diabetes. All of these consequences show up in our hospitals, in our emergency departments, in our consultation services, and very often we miss them as medical professionals. And this can lead to further trauma, to more consequences on the health and the life of these children. So this is why a discussion like the one we're going to have today is important. Many children actually don't disclose having been a victim of violence, as you all know. Globally, less than 1 in 10 actually ever reach out for a response or support services. So it's up to us really to come forward and make sure we can identify as many as possible and support them through our different services. So being trained in recognizing warning signs and symptoms, being equipped to safely ask about violence and provide initial support to children, and provide the right pathways to other services, justice, recovery, and healing. All of that is super important. And this is why also in the Bogotá call to action, which was the outcome document of the first ever global ministerial conference on violence against children, response and support services was identified as one of the the 3 key breakthrough areas to focus on in the future. Of course, we're not saying here that health has all the answers. It's only one among several sectors that needs to take care of those children, but certainly an important one. And recognizing that the response needs to be multisectoral is another element of our discussions today. Social welfare, education, and justice are among the other sectors that have a key role. If we manage to build up the right communication, coordination between all these services, children and adolescents from violence, suffering from violence will gain. They will not have to retell their story over and over again. They will benefit from immediate information and intervention. And there will be clear referral pathways so that the child can reach all of the different support services needed. I mentioned the Bogotá call to action, which is still open for signature, by the way, if your country hasn't done so yet, which called for this as one of the top priority areas. Since then, we've been working with countries to follow up on the pledges they've made in this area and are encouraging them to accelerate progress. And in preparation for the next ministerial conference, we'll certainly see this as a central area for future discussion. So thanks all for being there. I look very much forward to hearing from different countries about how they're integrating child-centered response services into their systems, from survivors, of course, about what made a difference for them in their recovery, and from practitioners about what it means to respond to violence in their daily work. So thanks to all for being there, and I look forward to the discussions.
Thank you so much, Dr. Krug. That was a great setting of the scene and really bringing in the personal experiences. We've got a delay with Shima joining us, so without further ado, allow me to speak you through the agenda because it is a fascinating and full one. We are going to be starting with focusing on the power and the importance of lived experience. And then we're going to look closely at the Bogotá pledges in the area of response and support services. After that, we'll be moving to a country dialogue with esteemed representatives from around the world, and we will conclude with a practitioners exchange. So as I think that we still are waiting on Shima, I'm going to invite our next speaker to go ahead so that we don't lose any time. It really is a very full agenda. So I'd like to invite Dr. Mamira, who is co-founder of the Brave Movement. She's also a member of the Brave Movement's SAGE, which is the Survivor Advocates Globally Empowered Advisory Group, and the founder of Mutera Global Healing. Dr. Mamira, over to you.
Thank you so much. It's such an honor and pleasure to be here. Thank you to UNICEF, WHO, and all the organizers for having these really incredibly important dialogues. So I'm Tabitha, and I speak today not just as a co-founder of the Brave Movement, but as a clinical psychologist, a mother, a sister, a friend, a global citizen, but for this context, more importantly, as a survivor. I'm a survivor of childhood sexual violence at the hands of a family friend I called uncle. And no one ever told me not to say anything, but something around that context, I just knew that you just don't say a thing. And to fast forward 20 some years later, I ran across a young child who had just been assaulted. And everybody knew, but nothing was done. And that was the first moment that I realized, looking in her eyes, it felt like I was looking at myself again. 20-something years later that this happened to me, it still happens. And silence is still the biggest part around it. And I knew I had to do something. I had to say something. So I carry that truth with me in every room I enter as the truth of being a survivor. I carry it now. I carry it in here for the millions of children who couldn't be in this room, who still can't speak, and who are still waiting for action. So let me start with something really clear. Survivors don't need sympathy. Anytime you say survivor, you see that little head tilt some people have, or really well-intentioned, oh, I'm sorry that happened to you. And that's wonderful, but it doesn't change anything. We need systems. Systems that respond, systems that protect, and systems that heal. Because for so long, these spaces have invited survivors for just their stories and then go on your merry way. Now we feel bad enough to do something, or at least to care. But Brave said that was not enough. And luckily, many organizations and governments have listened, and survivor voices more than ever are more than just a story of trauma, but a story of hope. So we are here today because promises were made in Bogotá, bold pledges, ambitious goals, and we applaud that. But we know that pledges are only powerful when they're backed by plans. And plans mean nothing without people, right? So especially the people most affected. At the table, guiding the way. We know those closest to the issue are also closest to the solution. So what does lived experience bring to this fight? For us, One, it brings truth. Survivors cut through the red tape. We get straight to the heart of what's broken because we lived it. We know what it feels like to ask for help and be met with silence, to be disbelieved, to be bounced between services that don't talk to each other. Our stories aren't abstract. They're the missing data in most policies. We are the evidence. We are more than numbers on a page. We have names, we have beautiful faces, we have families, careers, and that is hard to ignore. So when that evidence is ignored, violence repeats, trauma multiplies, and systems fail again. And children are at the heart of who suffers more. What else do we bring to this? Is accountability. We don't just want to sit at the table. We want to be part of building that table. And as one person said before, if you're not on the table, you are on the menu. Survivors are done being on that. Because when we lead, we demand more than declarations. We ask real questions. Where's the budget for these services? Where's the training for frontline responders? Where are the mechanisms for feedback from survivors, from youth, from children? We're not here to decorate the strategy. We're here to drive it forward. In at Brave, we provide these resources. We don't just talk about it and let you figure it out. My colleague will be able to put this hopefully in the chat if Jenny's here, but we have created pathways policymakers on engaging with victims and survivors of childhood sexual exploitation and sexual abuse. These are real resources that you can reach out to us. We can do more than just give you a piece of paper on how to do this. We've created risk assessments for how to involve individuals with lived experience in a trauma-sensitive way. Healing and well-being, all of this can be found on the Brave website. And again, you can also reach us if you need more ways on how we can do this in an accountable way. And 3, my last one, we bring hope. Yes, hope. Because even after all we've been through, we have not given up. We're still here fighting. Not just to survive anymore, but to build a world where no child has to endure what we did. And that kind of hope is powerful, but it's not naive. It's rooted in work, real work, policy change, funding shifts, culture transformations. So we know this doesn't happen overnight. But let me be blunt. If children are still being abused, if survivors still face stigma, if services are still underfunded, then we are not done. We still have a lot of work to do because we know good intentions do not protect children. Systems do. Conferences do not prevent abuse. Action does. So do not misunderstand me that this is about them versus us. I've heard this story. I'm African. We love storytelling. That's how we learn. But I don't know how true this is, but that apparently when you get black ants and red ants and put them in a bowl, they actually live very, they can live well together. But once you shake that jar, then they start fighting. And so with this issue of child abuse, it's not the government or the UN or the survivors versus it's who is shaking the jar. That's where we need to turn our attention because we all are needed to do our work for children to really be protected. So when this happens and we start pointing fingers, well, the UN is not doing enough, or maybe it's UNICEF, maybe it is the governments, or the survivors are too sensitive, or they're too loud. We need to pause and say, who is shaking the jar? That's where we all need to turn our attention. What keeps this going? So what do we do now as I am wrapping up? We require mandatory funding for integrated services, survivor-informed support services in each country. Cross-sector coordination that works in practice, just not on paper. We know a lot of wonderful reports exist, but is it working? Survivor councils at the national and global levels, data systems that capture lived experience, not just bureaucratic checkboxes, and political will. I'll repeat that, political will. The kind that doesn't disappear just after news cycles or after Bogotá. And that is wonderful that UNICEF and WHO have brought this dialogue, that there is more after the conversation happened. So at Brave, we're calling for this and more because children don't have time to wait. The next survivor shouldn't have to fight alone. We are tired of being the afterthought in decisions that impact our lives. So today is not just about updates and reports. It's about translating announcements into actions. And so I will end asking that action does start with listening to those who've lived the harm and are now leading the change. So to every policymaker here, make survivors part of your process. Every practitioner, center the child, not the protocol. And all our allies, don't just amplify our voices, invest in our leadership. And to every survivor here, your voice matters, your story matters, you are not alone. And to everyone else, my favorite African proverb, everybody knows I say this at the end of everything: if you want to go fast, go alone. But if you want to go far, go together. So let's all go together and end childhood violence once and for all. Thank you for having me. Thank you for this wonderful dialogue.
Thank you so much, Dr. Mamira. So many critical reflections, and not just reflections, calls to action. And you were very specific in your asks. I took many notes, and I hope that that will really guide our discussion today. That's why we wanted you up front and really helping shape and orientate us to the right framing and the right centering, which, as you said, is children, not necessarily protocols, but let's keep children in mind. So without further ado, Shima Sengupta, the UNICEF Global Director of Child Protection, has joined us and is now able to share a few quick reflections before we proceed with the next agenda item. Dear Shima, over to you.
Thank you, Afrouz. And first of all, huge apologies for joining a bit late. I had tech challenges, believe it or not, with my Zoom. But having said that, very happy to be here. And I'm so pleased that I joined just as Dr. Mamira was speaking, because that was really very powerful, very, very useful. And I think something that we should all remember as we work on this. So on that note, excellencies, colleagues, civil society partners, survivors, friends, young people, everyone that's here. It really, really is for me a privilege to be here, to be part of this important dialogue. It really is. And like I said, it was fantastic joining when Dr. Mamira was speaking. In UNICEF, we're really pleased to co-host this dialogue series with WHO. And as you know, today's focus is on response and support services. And this really is a vital area of collaboration between WHO and UNICEF. I do want to build on, I know I missed listening in on Etienne's remarks, but I do want to build on what he has said, but also on what Dr. Mamira has said. And I do want to reaffirm that violence against children is not only one of the most serious public health challenges of our time, it is also a violation of the rights of every child that every child is entitled to. The right to grow up free from fear, free from harm, and with access to justice and protection when those rights are breached. And these are not, as we just heard, these are really not aspirational ideals. They are binding obligations under the Convention on the Rights of the Child and its optional protocols. And they are central to the vision of the Sustainable Development Goals. So as we move from principles to practice, we must ask, how are we turning these commitments into concrete action? And again, Dr. Mamira spoke about, it's not something that's supposed to be, you make the pledges, you talk about it at a conference and it's over. So how do we move these into concrete action? Since last year's ministerial conference, we've seen renewed momentum to operationalize the 3 high-impact solutions to end violence against children. And this, to me, is really encouraging, all right? So the 3 high impact solutions that we are talking about, which I'm sure everybody knows, but I'm going to say anyway, is universal access to parenting support, safe and enabling school environments, and response and support services for those who need them. So today, of course, our focus is on the third solution, response and support services. I do want to emphasize, though, that prevention and protection must go hand in hand. Our responsibility cannot just be on waiting for disclosure or reacting after harm has occurred. We must proactively create an environment where violence is less likely to happen. Homes, schools, communities, and digital spaces are safe by design, and that really is our accountability. When violence does occur, our systems must be ready. A child who has experienced abuse, exploitation, or neglect should really not have to navigate fragmented services. This demands coordination across health, education, welfare, and justice sectors. It also calls for the development of child protection systems that are inclusive, are adequately staffed and equipped. And often these are the parts where we see the challenges, right? You might have a system, it may not be inclusive, may not be adequately staffed, and so on. So it really means embedding child rights and protection into those national policies and budgets, and into every institution that interacts with children. And crucially, it means engaging children and adolescents themselves in shaping these responses. Their perspectives are critical. They help us understand where our systems are truly working. And as we just heard from Dr. Mamira, engaging the survivors, listening to them and hearing and understanding what is it, that's very important. In closing, I would like to say that I'm really looking forward to today's dialogue, to hearing the reflections of survivors, which we've just started off, to learning from our partners around the world about how pledges are being implemented, and to collectively reinforcing our efforts so that we can say with confidence, we did not only pledge, we delivered for every child. Thank you so much.
Thank you. Thank you so much, Shima. Thank you, Etienne. Thank you, Tabitha. Such strong words, such a strong opening. We're going to move straight on because we've been working with Oxford University for a couple of months now, actually since November, the Bogotá Conference, to better understand what we're seeing in some of these pledges. What are some of the trends we're seeing? So without further ado, I'm going to hand over to University of Oxford, Amia Bhatia and Anya Zinke-Almang for a short presentation on what we're seeing on the response and support pledges. Over to you, Anya.
Thank you so much, Sabine. Thank you, colleagues, and good morning, good afternoon, and good evening to everyone here today. My name is Amia Bhatia. I'm an associate professor in the Social Policy Department at the University of Oxford, and we are delighted to be in this space of learning, in this space of action, and in this space of joint collaboration. We sat in the winter in November and December on the small island that Oxford is located within and downloaded all the pledges. We read all of them. We started to code them and analyze them. We were so delighted that so many countries came forward to make bold commitments to respond to violence and to prevent it. So our analysis has taken us on a journey to really uncover and unpack, what did governments mean when they made these pledges? What is the map that is emerging from these pledges that guides us towards action? We know the burden of violence against children is high and unequal. We know survivor voices are crucially important. And we know the question of what happens after violence, of response and support, and how to make it equitable, just, safe, is essential to the future that we want to build together. So I'm glad to turn it over to my colleague Anya, who will share an overview of what we learned as we read all of these pledges and synthesized what was coming out of them with regard to response and support. We look forward to being in conversation, to learning together, and to acting together. Over to you, Anya.
Thank you so much, Amia, for the introduction, and to our moderators and the WHO and UNICEF for organizing this event. The Global Ministerial is a landmark event built on decades of advocacy and research, such as the development and implementation of the INSPIRE framework, and a growing set of global commitments to prevent and respond to VAC based on evidence-based practice and programming to create high-impact solutions. Today, we'll focus on the ministerial pledges addressing response and support services. Our team conducted a content analysis, as Amia has said, of the 101 government pledges and supplementary documents, where we did line-by-line coding in each document to identify and discuss emerging themes and look within and between the pre-existing pledge categories to draw out the commitments to response and support services. And so to do so, we examined 2 questions. First, which countries made pledges to response and support addressing VAC, and which actions were committed to for response and support services. From all 101 countries that submitted pledges in November, a total of 63 countries made pledges to the predefined response and support services category. That was the predefined category and pledges indicated by a checkbox at the very top of the pledge. However, through our process of open line-by-line coding, we found that 72 countries had made pledges and specified actions to response and support services. The difference in this count comes from commitments that were described in other predefined categories that were not initially captured in that original count. And this highlights that proposed actions to address VACs are complex and highly interlinked with other integral pieces of prevention. The graph on the right shows how these 72 commitments to response and support services are distributed by WHO region, where the total bar length there in gray indicates the total pledges submitted within each region. You can see that across all regions, response and support was a key area of countries' pledges. And again, here in this graph, we can show the breakdown of pledges for response and support services by World Bank income groupings, which again clearly shows response and support services as a breakthrough area with opportunities for further commitments in revised and updated pledges. And looking into the key terms from the pledge documents, we can see already some themes arising from this word cloud, such as justice, case management, health, and mental health. And closely aligned with that word cloud, we present the 6 distinct themes that arose from the 72 pledges on response and support services. This graphic shows how those 72 pledges break down into those themes, shown on the left side of the screen. Those themes include strengthening institutions, services, and systems, reporting channels, access to health and mental health for survivors, case management systems, access to justice for survivors, and referral systems. Some pledges included more than one of those themes, which we double-coded to each relevant category to make sure that we captured the complexity of those commitments. And we'll now walk through each of those themes in greater detail. So first, and most commonly, 50 countries pledged to strengthening response and support institutions, services, and systems. This theme includes pledges to provide capacity strengthening and increase the number of social workers and healthcare workers, and to dedicate specific budget for capacity strengthening, to establish or expand integrated one-stop centers or helplines, or to fund country-specific VAC response services or programs. An example from this theme is from Costa Rica that pledged, to strengthen interinstitutional and intersectional response through programs and projects related to family and survivors of violence. While this theme is very broad, it highlights integral pieces to creating robust response and support systems with specific commitments to capacity building and dedicated resources to implement and sustain those pledges. Next, 32 countries pledged to make disclosure of reporting of VAC by children or adults safer and more accessible. This theme includes pledges to create or strengthen helplines and integrate one-stop centers into existing services, and to increase capacity for disclosures within school and home environments. An example from this theme comes from Liberia that pledged to establish a national call center to address VAC by 2030. Next, 36% of countries that pledged to response and support actions included commitments to make health and mental health services more accessible, child-friendly, or integrated into existing services. This theme includes pledges to create or strengthen mental health programs, integrate health services, specifically medical support, into existing child protection services or response categories or centers, and to strengthen crisis and phone lines to provide medical and mental health support. The example from this theme comes from Botswana, that pledged to scale up mental health and rehabilitation support for survivors. The integration of health, justice, and social support into centralized services featured across pledges, which we will see in the following themes again, and highlights a shift to center safe reporting and access to services for survivors through integrated care. Next, 25 countries pledged to create, improve, harmonize, or scale case management mechanisms and systems to manage, monitor, and coordinate cases of VAC. This theme includes pledges to create or strengthen information systems, and to improve coordination of health, social, and justice sectors and child protection actors to improve case management. An example from this theme comes from Cabo Verde that pledged to implement an integrated case management and information system with a digital platform for registering cases for increased coordinated response between actors by 2026. A further 24 countries pledged to make justice services more accessible, child-friendly, or integrated into existing services. This theme includes pledges to integrate justice support into existing services or response centers, create child-friendly reporting procedures in court, create legal clinics for survivors, strengthen crisis and phone lines to provide legal support, and to train legal actors to provide child-friendly services for survivors. An example from the theme comes from Jordan that pledged to scale up child-friendly interview rooms and justice procedures by 2030. And lastly, our last theme was made among 21 countries that pledged to create, improve, expand, and harmonize referral systems to respond to and support survivors of VAC. This theme includes pledges to train teachers after referrals after disclosure, train caregivers to identify, support, and seek services for children that experienced violence, and to create a list of available referral sources to ensure that survivors are directed to appropriate and accessible support. An example from this last theme is from Jamaica that pledged to implement a national early warning system to coordinate referrals and case management processes across sectors by 2030. And now these 6 themes we identified range across and included actions, commitments, and roles for specific sectors in the child protection system. 4 sectors, health, justice, education, social development, and welfare, were most commonly mentioned, which we will step through individually. So first, let's talk about health. Many references were made to this sector, with some pledges specifically referencing the Ministry of Health as a key government actor to lead or coordinate commitments. Key actions for the health sector are similar to the theme we described before, which includes increasing accessibility, integration of health services, and capacity building for health professionals. Next, and also similar to the theme we discussed previously, countries may also have references to the justice sector and related ministries. Key actions included creating safe and accessible judicial processes, integration of legal support, and capacity building for legal actors. And aligning with other breakthrough areas, the education sector and the Ministry of Education featured as a key sector and actor for commitments to response and support. Key actions included improving case management in education systems and capacity building for teachers and caregivers in schools. And lastly, governments frequently also reference the social development or welfare sector. Key actions included integrating social support into existing services, school and health settings, and provided capacity building for social workers and counselors. Additionally, while these 4 sectors were commonly referenced and identified as key actors and leaders to implement actions, many governments also emphasized the importance of multi-sectoral coordination to successfully develop and sustain pledges to address response and support for VAC. The global commitments we have discussed today that centered on establishing, strengthening, and expanding response and support services for VAC is an important breakthrough area in the global agenda given the high prevalence of VAC. We found that of the 101 pledges submitted in November 2024, 72 countries included commitments to response and support services across the 6 themes that we mentioned. So what's next for the global commitments to respond to and support cases of VAC as we approach the 1-year mark since the ministerial? We suggest 3 considerations for response and support services. First, it's essential that ethics of data collection, children's rights and best interests, safety and privacy are at the center of efforts to improve response services. Second, further efforts are needed in validating and implementing evidence for response and support programs and services. And lastly, it's also essential to involve survivor groups, children, and civil society organizations in the development, implementation, and monitoring of response and support services to center survivors and children's voices following VAC. And so we are very grateful to have had the time to share our findings, and we're looking forward to the conversation about response and support services. Thank you so much.
Thank you so much, Anya and Amaya. That was amazing and so rich. And I could see some reflections in the chats and requests that we share the slides afterwards, which I believe will be done with a package after the webinar. But I think, you know, your presentation and your analysis really show that depth and that breadth when we're talking about response and support services. And obviously a short webinar will not do justice to your analysis, but also, you know, the work on the ground and the reflections on the ground and the resources available. But I really took away, you know, those reflections around multi-sectorality, which I think is a key one, the child-centered and survivor-centered approach, and also making sure that they're underpinned by systems and budgets, because we saw that, you know, those systemic pledges were among the highest commitments made. But thank you very much. That was really helpful for setting the scene. I'm really pleased to now move to our country roundtable, where we're going to be talking about progress in implementation of these exact pledges, as well as, you know, reflections on challenges as well, and areas for moving forward and collaboration. So delighted that today we are going to have Ms. Natalia Efremova, who is the Deputy Minister of Labour and Social Policy from Bulgaria. We're also delighted to have Ms. Ramoroka, who is attending on behalf of the Principal Secretary of the Ministry of Child Welfare and Basic Education in Botswana. And we also are expecting shortly to join us from Jordan, Dr. Mohammed Mekdadi, the Secretary General of the National Council for Family Affairs. So we are going to have a few minutes of discussion with our esteemed panelists. And I want to start with you, Deputy Minister Efremova. Bulgaria's commitment to advancing children's protection from violence is reflected in its recent pledges in Bogotá. And your pledges included raising awareness and accessibility of the National Child Helpline, and also the implementation of a multi-year and multi-sectoral national program for the prevention of violence and child abuse. These initiatives are obviously critical for ensuring timely and effective support for child victims and survivors. So we're really eager to hear from you this morning, this afternoon, this evening, wherever colleagues may be, the progress you've made in delivering on these pledges, and also particularly given that theme that is coming out, how you've managed to bring together different sectors to be engaged and coordinated in this work. Thank you.
Thank you, Afroz. Dear friends, first of all, great thanks to the UNICEF and WHO for organizing this global webinar on response and support services. For me, it's really a great honor to participate in this important event and to have the opportunity to present our progress, the progress of Bulgaria, and also maybe the challenges associated with the protection of children from violence. This year, in 2025, this topic was one of the main priorities of the Bulgarian government, and significant progress was made, I think, in terms of measures related to prevention of violence and abuse of children. We are also making targeted efforts to increase the sensitivity of the society on topics related to violence and against children. Firstly, as you've already mentioned, Afroz, I would like to start with the fact that we have a new action plan for the implementation of our national program for prevention of violence and abuse of children for the period of 2025 and 2026. It was adopted in June this year. And for the reason of implementation of this action plan, we have established interinstitutional working group this year. And by the end of the year, we plan that this working group should conduct a study of foreign experience and analysis of existing good legal practices for prevention, investigation, and administration related to violence against children with complex communication needs. We are planning to prepare a roadmap of measures and mechanisms for combating violence against such children, and offering a system for prevention and access to justice for children with difficult communication. This is first. And secondly, we have Bulgarian national telephone line for children, operating 7 days a week, 24 hours a day, free of charge. And I would like to note that since 2024, since last year, the chat application to it in real time gives online counseling for children. And since the 1st of January this year, the chat application is being accessible to every child in Bulgaria through its official website. Since the beginning of April this year, monthly interinstitutional working meetings have been held in connection with the frequent signals received on this national telephone line concerning Roma children in Bulgaria and families begging and wandering in the streets of Sofia, this is the capital of our country, and families living in illegally built shacks. A model plan for joint work of the different institutions concerned on the problems of illegally settled groups and begging children have been elaborated, which aims to guarantee the rights of children and create a more secure and favorable environment for them. As next point, I would like to share that we are developing national information system, and we are which aims to have common indicators on violence against children in order to overcome the challenges each institution can meet in collecting, monitoring, and reporting data. We are developing appropriate indicators for collecting sufficient and reliable data on cases of violence by and between children. Thus, it will be easier to measure the progress reached in prevention based on common indicators to track challenges in the prevalence of violence based on internationally recognized standards. And it's worth mentioning that we have a national social services map developed and adopted last year in Bulgaria that also includes specialized social services to provide shelter for people in crisis situation, victims of domestic violence and trafficking. These services are planned in the map for each of every district in Bulgaria. In these districts, specialized social services are also planned, such as information and consultation, advocacy and mediation, therapy and rehabilitation, and of course, skills training for persons in crisis and victims of domestic violence or trafficking. And lastly, but not least, in terms of response and integrated services, the scale-up of the Child Advocacy Center model in Bulgaria continues in 8 new regions in Bulgaria and municipalities with UNICEF's support. Bulgaria is also one of the 4 countries included in UNICEF-led global research multidisciplinary models of care for child victims and survivors of sexual abuse and exploitation in the digital age. I think I have covered maybe the most important, but maybe one, but not all the measures and everything that we are doing on the spot, addressing everything that was made by the Bulgarian pledge during the VAC last year. But I think my time is over, so I will stop here and will be glad to explain if there are some questions or something to be better developed in my presentation. Thank you very much.
Thank you so much, Ms. Efremova. That was fantastic, and absolutely, we do need to apologize that it is a very short time, so we know that you can't talk to the extent of everything that's going on, but I think you gave an indication of that, multi-layered approach and certainly multi-sectoral. So hopefully, if time allows, I will come back at the end with a final question. But thank you so much for sharing those commitments and that important progress. Now I'd like to invite Ms. Rama Roka from the government of Botswana. And we also see from Botswana a series of important pledges coming from the Bogotá Conference. These include school-based interventions, such as enhanced psychosocial support and referral mechanisms, as well as broader efforts to improve the overall child protection system. We also understand that there's been a particularly monumental step recently, which is the launch of a costed national plan of action to prevent and respond to violence against children, and then also work with the justice workforce to ensure child-sensitive and safe support for victims and survivors. So we're really eager to hear from you how this work is being operationalized on the ground and what insights you might be able to offer to other countries who are striving to ensure that services are accessible, sustainable, and responsive to the needs of children. Sorry, Ms. Ramoroka, I think you are on mute, so if our colleagues can kindly assist.
Oh, thank you. Thank you. I'm sorry for that. Your Excellencies and all colleagues, thank you very much for having me. It is really an honor that I'm attending this consultation. And I would just like to briefly go over what we as Botswana have progressed into. For us, we have recently, or at the end of the year, we elected a new government. So through this government, we have proclaimed that we are a human rights-based, we'll be focusing our programming on to human rights-based. And also we have established a new ministry, which is called Ministry of Child Welfare and Basic Education. And we are seeing from this creation of a ministry where child welfare will be amplified from a division to a department. This means that most of the efforts or issues that have been handled across other ministries will be handled in one central area. So we also have scaled up on child-friendly justice. That in that particular aspect, we are training all the different stakeholders that include the police, the social workers, the magistrates, and the magistrates on child-friendly justice. So this is an ongoing initiative which we intend to scale up as we continue. We have also developed a multi-sectoral national child-friendly justice SOPs. These standard operation procedures are meant to guide the justice system in handling children's issues in the judicial system. So this will be a guide to everyone who is handling children in such an environment. We also have we are supporting the scale up of virtual courts for children in the child-friendly police stations. We have so far 8 centers that we have child-friendly centers. Through this, we are advocating that we take this initiative to other strategic areas within the country, and we also are working towards providing or handling children's issues in camera. The other action or progress that we have made is that we have developed a multi-sectoral 5-year plan, as we have said, which is a blueprint for the different sectors that are dealing with issues of violence against children. And alongside this, we have the costed plan, which will ensure that sectors across will have an increasing or incremental yearly budget from the government, and that will ensure implementation of what we have pledged for years. We are also developing national guidelines on the prevention of violence in schools. So far, we are piloting the guidelines both in urban areas and in the rural areas. After that, we will be rolling out these guidelines throughout the country. As the government, we have also made a public pronouncement to end corporal punishment across schools, so that no child is punished through corporal punishment. As we know, in Botswana, even our legislation was allowing for that. So that's one area that we have started to abolish the corporal punishment, and intention is even to go out to the communities. And in the meantime, whilst we have stopped corporal punishment in schools, we are looking for other alternative ways that teachers can engage in disciplining children. We have also had, in May 2025, we have had a groundbreaking for the Child Helpline Center, which we believe it will be a milestone, as children will be able to report violence and they'll get help. And even everyone who sees violence against children will be able to report such violence. And currently, we are in the process of establishing a social work council to regulate those that work with children and other vulnerable people. We are also in the process of reviewing the Children's Act so as to make it comprehensive. We have seen a lot of involvement in the environment that we live in these days. So we are in the process of reviewing the Act, which is the key legislation in dealing with children in Botswana. We are also in the process of developing the Orphans and Vulnerable Children policy, which is aiming at protecting the most vulnerable children. We are also in the process to develop parenting guidelines, as well as alternative discipline manual. So conversations are ongoing with some of our partners, including partners like UNICEF. In all the processes that we take, we ensure that there's meaningful participation of the children. We have sessions in matters that affect them, and we have a forum that consists of different children from the different districts or municipalities that we have that represent children from their areas. So in all matters that affect children, child representatives, or even including others that are not part of the representatives, they are engaged. And we also, as a way of making sure that people or own this, we do multi-sectoral approach to all our programming. So this is one thing that we really do. And for sustainability, we think we as government, we reach out to our partners, including UNICEF, like for instance, in the development of the National Plan of Action, we engaged, we're assisted by UNICEF, which afterwards the government will be implementing. UNICEF has provided the technical support, and for us as the government and other stakeholders will be doing the implementation, and the government will ensure that we roll out the plan as well as monitoring of the plan. I don't know. For the challenges, I don't know if my time is up.
If you like, we can hold on the challenges, Ms.
Okay.
Ramaraka. We can come
Okay.
back to the challenges, and I can put it to all three panelists. I think that was incredible. Again, I do apologize that we had to give a time limit, but it's really great to hear, very systemic and important changes in Botswana, such as the elevation of the division to the department and that coordination element. I mean, those are very important in terms of elevating, the issues of children and child protection. And then I think we heard a lot, about the groundbreaking for the Child Helpline, which is exciting. We're going to be hearing from Child Helpline International and another Child Helpline later. So let me, if it's okay with you, I will come back and ask the question on the challenges in a moment, so you can think about those for a minute. But for now, let me invite Dr. Mcdaddy, who is the Secretary General of the the National Council for Family Affairs in Jordan. So, Dr. Mcdaddy, can you hear me okay?
Yes, for me. Can you hear me?
Yes,
okay.
We can hear you wonderfully.
Yeah.
We can't see you yet. But
well,
let me
actually, there is a problem with my camera, it seems, so I couldn't.
Oh, okay, no problem. So long as we can hear you.
I'm
thank
trying
you
to, but...
Yeah,
Sorry.
it's a little bit invisible. No problem. So long as we can hear you. Let me say that we've also seen that Jordan had made several important pledges at the Global Ministerial Conference, and these include commitments to develop a nationally accredited in-service social work capacity building program, also commitments enhancing collaboration between the justice and social service sectors, such as through one-stop centers, and also to scale your family violence tracking system nationwide. So just like the other countries that we've already heard from, there is much to learn. But for today's dialogue, we'd like to invite you to share how the National Council for Family Affairs has really inspired and mobilized different sectors to prioritize and support child victims of violence. And also, if you could talk a little bit to how the family violence tracking system is helping to advance this work. So over to you, Dr. Mcdaddy.
Thank you, Dr. Afrouz. I'm so sorry for being late. I'm sorry for all, because it was my mistake on calculating the time difference. I thought I am on time, but it seems not. So I'm so sorry for that. Well, actually, to talk about Jordan system regarding tackling family violence and violence against children. Well, Jordan started this work in 1997, actually. The starting point was in creating a division, small division, within the Public Security Directorate. It's called the Family Protection and Juvenile Department. Well, this department, this is the kind of one-stop shop, because it includes all the services together, the social work and the forensic doctors, psychiatric, and also NGOs, of course, the police officers for the investigation, reporting, and so on. Well, after that, the National Council for Family Affairs, we create what we call the National Team for Family Protection. It was in 2000, actually. Well, this team at that time, it was includes 8 national organizations, governmental and non-governmental. So now we have 35 national organizations. We meet in a regular basis every month, actually, and sometimes we meet for one case. We make like an investigation mechanism with any failed cases in the system. So this team, which includes the Judiciary Council, which is the justice system, the health sector, the social sectors, and also the NGOs, and the health in the private sector also, they are included within this family protection team. Well, the other thing that this is how we started this kind of multidisciplinary work together and developing the whole system in Jordan. When we talk about the first national document that we developed in Jordan, it was in 2006, which is the National Framework for Family Protection. This framework, which includes the rules and responsibilities for everybody, the referral system between organizations, the reporting mechanism and the investigation mechanism, and kind of services that should be provided, the time for providing an emergency services, and the how to do the case management between agencies together anytime. So based on the national framework, in Jordan we developed the national SOPs, which has been endorsed from everybody who is dealing with violence against children. When you talk about the NGOs, the international organization, UN, and also the government, it has been endorsed from everybody. And based on this national SOPs, we at a National Council for Family Affairs with our partners, we develop an internal procedures for the Ministry of Health, Ministry of Education, Ministry of Social Development, and for the Family Protection Department. And now we are in a process to develop an internal procedures for the health private sector. So what we developed regarding to this policy and procedures, this creates a national capacity building system for social workers, for the police officers, and for the judges who are dealing with the family violence. Recently, last year, Jordan succeed to pass it's a bylaw for the professionalization of the social workers. So based on this bylaw, we are starting to license the social workers who are especially working on this issue. On the legislation side, we developed 3 major legislation in Jordan, which is the family protection law, and the juvenile law, and recently in 2002 we developed the child right law, which includes all the mechanism, the rights of children. And now we are in the process to have like a document which it's an indicator to guarantee how the government will accomplish what they included within the child right law. So based on these policies that we developed, and the procedures and the framework, Now we translated all these on a tracking system, national tracking system. It's supported by UNICEF, and I think this system is being implemented in more than 50 countries worldwide. So we finalized the system with our partners, and we start the implementation in the capital, Amman. Now with our partners, with the NGOs, with the ministries, Ministry of Social Development, Education, and the Family Protection Department and Ministry of Health, we develop a 3 years plan for the dissemination of the system in all over Jordan. Well, actually, this system, why it's important? Because, well, in one hand, it's like a reporting mechanism. It's a referral mechanism between agencies. And also, we look at the system as a database that we can analyze. We can come up with some reports for the advocacy, for changing the policy, legislation, and so on. But the most important thing actually for us as NCFA, as the National Council for Family Affairs, is to monitor the implementation of the procedures with our partners. Are they implementing the procedures that we agreed on or not? So it's kind of an accountable system in Jordan to guarantee the quality of services that the service provider are providing for every child, and not just children, because it's tackle all the family, elderly, and also women and children. Over to you, Doctor.
Thank you so much, Dr. Mekdadi. That was fascinating. Really interesting to hear the long history of that multi-sectoral approach. And also, I think particularly pertinent to hear how you're translating the frameworks into operations and how a tracking system is enabling that, both as a day-to-day case management referral system, but also informing national policies and, you know, monitoring and accountability. Really fascinating. To all our country panelists, there was such a rich and full amount of information that you shared, and there are requests in the chat if it's possible to share any documentation. So if there is any published material that you're able to share, policy frameworks or SOPs, please, if you don't mind sharing them with us, we can also share with the registration list following the webinar. We only have a couple of minutes of this segment, so I just want to give you like 30 seconds. Sorry, 30 seconds, possibly 45 seconds for you each. If you have one key kind of learning or message you really want to emphasize, you know, from the progress to date and that journey towards, you know, strengthening response and support services. And I think, you know, really bearing in mind that call to action that was presented to all of us at the beginning from Dr. Mamira on making sure that these are really focused around the child and they are survivor-centered. So Ms. Efremova, can I ask you in 30 seconds to just share one key final message?
It's very difficult, but okay. My focus will be on the constant need to increase the professional capacity of all specialists engaged directly in their work, everyday work with children and families from vulnerable group. It's very important to have for them trainings and capacity building for these professionals in order to support the children victims of violence. This would be my focus today. Of course, there are lots of other things that could be shared. Of course, conducting campaigns, changing public attitudes and increase sensitivity. We do this in Bulgaria, but we are now in Bulgaria focusing on the quality of services that we provide. Thank you.
Wonderful.
So much.
Thank you so much. I'm sorry for giving you this hard task, but absolutely makes a lot of sense. Ms. Ramalroca, would you like to have a go in 30 seconds? What is that key learning or message you would like to share as we close out this section?
Thank you, ma'am. The key message that I have is that we need to have adequate staffing in order to really go out and prevent violence against children, as well as enough resources to reach out to those children, as well as community engagement. We need our communities to really take this upon themselves, to be part of the prevention and the prevention of violence against children. Thank you very much.
Thank you so much. Really critical key messages. And Dr. McDaddy, if there's one message you want to leave our participants with today, what would that be? Sorry, again, apologies, 30 seconds or less.
That's okay. Well, I think a well-structured and sustained coordination and a multi-sectoral mechanism, it's a must. We need to look at the quality of services and accountability system within each country. Also, it's a must.
Amazing. So huge thank you. I'm now going to hand over to Sabine for the next segment. An enormous thank you to our esteemed country representatives. Thank you.
Thank you, Afrouz. And I also really want to thank Bulgaria, Jordan, and Botswana. I mean, that's the reason we're doing these digital dialogues. We really need to learn from each other. We need to move forward, not slowly, but fast. I agree with Tabitha. We need to move together, but still we need to move fast. And sometimes we have pioneer countries like Bulgaria, Jordan, and Botswana. There's other countries, Namibia, making a huge difference. And so I think if other countries can learn from that, it's great. I want to move on to the next session, which is a practitioner exchange. And so we have three great speakers today. We have Birgit Lund Hendriksen from Save the Children Norway. I almost said UNICEF because she used to be the UNICEF. She'll be speaking on child protection system strengthening. Then we have Helen Mason taking a very different perspective from Child Helpline International. And then we have Berit Kieselbach, who's a technical officer in the WHO Violence Prevention Unit, and she'll be taking the health sector perspective. So thank you to the three of you for being with us. Cassia will be putting the questions into the chat. I am going to start with a question for you, Birgit. And reflecting on what we've just seen, can you briefly highlight how you think child protection systems frameworks support governments and practitioners in addressing the challenges that Tabitha raised so eloquently in terms of the services for victims and survivors?
Thank you, Sabine, and thank you to WHO and UNICEF for organizing these really important digital dialogues. Let me start by saying that the Framework for Action on Child Protection System Strengthening, which was developed by World Vision, UNICEF, and Save the Children, was launched last year at the Bogotá Ministerial Conference, outlining 6 priority actions for governments in close coordination with other actors. All 6 priority actions are relevant for response and support services, in particular, continuum of services, human and financial resources, data and evidence, as well as child participation to ensure services are responsive to the specific needs of the children. All this have been touched upon by our speakers. So why did we feel that there was a need for a framework for action when most agencies have quite detailed guidelines on child protection system strengthening? There's an urgent need for the child protection sector to move beyond projects that are time-bound, geographically limited in scope, and often issue-based. We haven't heard that today, but a lot of the work that's being done in child protection is project-based. Issues are often entry points for children to come in contact with protection services, but children at risk face multiple risks, and service providers respond to multiple violations. So a strengthened child protection system ultimately allows for a holistic approach to prevent and respond to all child protection violations. As is already the norm with the health and education sector, there we don't talk about whether it should be a systems approach. We need to shift to an approach that builds on existing government and non-government structures that can be scaled up throughout a country and become sustainable over time. And this is even more critical these days with the current aid and crisis environment that we're in. So in addition, we have to ensure that we're supporting government to build the same systems. Otherwise, we end up with parallel structures that are difficult to scale up and sustain, and wasting resources that we really can't afford to waste. This was also the focus of a technical online workshop that took place this June, where 40 representatives from 16 UN and civil society organizations and alliances took place. And key conclusions included that child protection system strengthening should be framed as a cost-effective, sustainable investment for governments and donors, like we've been hearing from the governments today. Government leadership is fundamental, and greater alignment and collaboration are critical, especially at country and subnational levels. Response and support services form a core part of a child protection system. As we've heard, children need strong collaboration between health workers, social workers, police, justice, and education actors at a minimum. In addition, we really need to recognize that many protection services are provided by non-government actors. These services are critical to a well-functioning child protection system and allow for increased capacity and outreach if integrated under the government umbrella using consistent case management and data management tools. Finally, strengthening child protection systems is relevant not just for the development context, but also for humanitarian and nexus context. A functioning system strengthens anticipatory action and response. Additional support and services in a humanitarian context should, where possible, build on and strengthen the national child protection system rather than creating parallel structures. Thank you, Sabine. Back to you.
Thank you, Birgit. And I really suggest, if it hasn't been done so, to put the systems framework in the chat and have everybody look at it, because we talk about Inspire a lot and the 7 strategies. And as Birgit says, often these are very projectized. And I think having this as a backdrop is really essential. So thank you for raising that, Birgit. Over to you, Helen. Can you say something about the role of child helplines within the broader ecosystem, and maybe reflect a little bit on how helplines are today being used to address the challenges that our 3 earlier panelists from Botswana, Bulgaria, and Jordan addressed?
Yeah, my pleasure. Thank you, Sabine. And thanks for this excellent webinar series. Good afternoon to everybody. I'm Helen from Child Helpline International. I'm so happy to be here, and it's great to have this time together. Response and support is core business for us, so we're in the right place. And I want to impress upon you that we see child helplines as an entry point into the child protection system, a system that they shouldn't have to navigate by themselves. So Child Helpline International, we have members in 132 countries, and we're operating at the intersex of child rights and technology. And as we've heard from many of the pledges and the speakers today, child helplines are clearly prioritized as a real-time response to children who have been harmed or at immediate risk of harm, and to seek help and effectively enter into the child protection system. So we want to impress that effectively this is a tool to operationalize a multisectoral and coordinated response through these strong referral pathways and through the data generated every time a child reaches out. And then we combine that with functional standard operating procedures at national level to ensure that these systems can be responsive to the children and young people that do reach out to child helplines. Well, we listened to some of the speakers from the 3 countries that have been presented today. I think that the key things I would pick out is the emphasis on the cross-sectoral collaboration. And that's really why I think these referral pathways are so important. The referral pathways in the sense that they exist, but also to monitor the effectiveness of those referral pathways. Also very key to us is the data that is collected as a result of the contacts to child helplines can also function as a way to identify the health of those referral pathways. And what I also wanted to convey today is that whilst we work in 132 countries, this by definition means there are countries without a national child helpline. And we are committed to working with governments and partners to starting a child helpline in every country and territory of the world by the end of the decade. We're on the way, we're on that journey. We can only do it when we work together with you all and with government partners. And we think that when we harness technology effectively, we can go further and faster together. And this tried and tested methodology that we have is really helping us to see the reality of that vision and come to fruition. So I really impress upon everyone to join us and to join this journey with us. Look at the data that's generated in your country by the Child Helpline. Look at the issues that children and young people are bringing forward. We are the listeners. There are trained listeners on the end of these services by chat, via telephone, via web chat. There are so many different ways that children and young people want to reach out. And we really need to be at the forefront to really exemplify what we mean by an entry point into the child protection system. So thank you for the opportunity today. And I'm very delighted to also have my colleague from our member in Tanzania with us. And I'm going to hand straight over to Michael to give us a in the field perspective from Tanzania. Thank you.
Thank you, Helen. I hope I'm audible. And I want to thank UNICEF and WHO for convening this dialogue, for keeping children at the center of global commitments. And I want to start by sharing a small picture for everyone and the colleagues in this important convening. So imagine a 13-year-old girl alone at home facing violence from someone that she trusts. And in that moment of fear, she has only one thought: who can I call, or who could she call? With the 116 Child Helpline, which is the number that has been designated for all African countries, including Tanzania, a child like the one that I'm talking here about can reach a trained counselor within seconds, and someone will listen to them. They will believe in them and also connect her to health, justice, and social services. That is what we do every day. And taking an example of Tanzania, we handle over 10,000 contacts every day through call, chat, and also social media. So it's a huge number, and this shows how trusted child helplines are globally and also in Africa. And also talking of the system strength that we've been talking about, all this is happening because if governments put their commitments and strengthen the systems around child protection, service of child helplines globally will continue to strengthen the work that we do. But as child helplines in Africa, we are often the first door where children will come here and they'll find the door open when they are in distress. And we always are ready to directly work with children who are facing violence, neglect, exploitation, but also giving them the hope that they need. For us as child helplines, giving us a unique ability to intervene early and think children with life-saving support is very important. And this makes helplines not only response mechanisms, but vital bridges between a child's cry for help and the systems that must act. With over 23 million contacts annually here in Africa, child helplines show both the scale of children's needs and the pathways to meet them. Strengthening and integrating the 116 number in national child protection systems is a concrete way to turn global pledges into real protection, care, and justice for every child. You know, very many people convened in Bogotá, and all the promises that were made were promises for children. So we are very happy that the pledges should into real protection for care and justice for every child. I want to finally leave you by saying that every call to a child helpline is more than a statistic. It's a child asking for safety. Our duty as child helplines is to ensure that cry is never met with silence, but with care, justice, and protection. And finally, child helplines prove that listening saves lives, but only when linked to strong systems. Integrating child helplines into national protection frameworks turns global pledges into real impact for children. I thank you very much.
Thank you so much, Helen and Michael. Completely agree. We can't leave any child unheard. And with that, it's a perfect segue to Berit. Last but certainly not least, Berit will present on the clinical handbook for health professionals. Over to you, Berit.
Thank you very much, Sabine. So one of the greatest challenges in addressing violence against children is that it often remains hidden.
We have heard many times today that very few children feel able to disclose what they're going through. They have a lot of stigma. They sometimes don't know where to find services. Therefore, it's great that we have services such as helplines. And we know globally that less than 10% of those children who experienced violence ever come into contact with any official service. So this means that the large majority of children who experience violence never receive the support they need. So what we are trying to do is to work towards a vision where every health professional who comes into contact with children in their routine work, whether it's in hospitals, in clinics, in community health settings or elsewhere, has the awareness and the skills to recognize signs and symptoms of abuse and neglect. And just as importantly, they should be prepared to provide an adequate first-line response. Health professionals are uniquely positioned. Unlike many other services, healthcare is accessed by virtually every child from very early ages at one point in their lives. So they are in the position to identify children who would otherwise remain invisible. And to support this vision, as Sabine mentioned, we have developed a set of resources that can be used in pre-service training, so to prepare future health professionals, and also in-service training to strengthen the capacity of those already working in the field. And we have heard this as an important area to improve from our colleagues in countries, especially Bulgaria. So firstly, the clinical handbook responding to child maltreatment offers evidence-based guidance on how to recognize signs of maltreatment, how to provide a child-centered care, how to communicate safely with children and caregivers, how to provide care for survivors of sexual violence, how to offer psychosocial support through the LIFE CC approach. That's an approach that can be used in a very short time frame to provide immediate psychosocial support, how to document findings ethically, and lastly, how to liaise with other services. This resource is now available in 6 languages, making it accessible to health professionals globally. And we also have an accompanying training curriculum that can be readily used in trainings. And the second resource I would like to highlight is an interactive online course called Caring for Children Who Have Experienced Violence. This is a self-paced, scenario-based training with 3 modules, which is currently available in English, French, and Spanish, and being translated into Arabic. And it allows health workers to practice real-life situations, and at the end of the course, they will receive a certificate of completion. We are making these tools available free of charge so that ideally every health professional can feel prepared to provide a first-line supportive response to children experiencing violence. And we hope that this will help to break the silence and ensure children receive the care and protection they deserve. Thank you very much, and back to you, Sabine.
Thank you. I was thinking if I should try squeeze in another question to each of you, but I don't think so. I think you've been very comprehensive. I might just give you back 1 minute of your life. We've had just such an interesting group of speakers, Etienne and Shima opening with such inspiring words. Tabitha, thank you so much for bringing it to life and the reality. Bulgaria, Jordan, and Botswana case studies. So interesting, really. It's so different and so interesting. And then Berit, Helen, and Birgit giving us the insight from a technical perspective. And Afrouz doing great moderation. And our Oxford colleagues giving a good overview of where we're at and where we want the field to go, because we can't stop here. We need to move this. We want Oxford to come back in a year's time and say, well, this is where you were a year ago and this is where you are today. The pledges are better, they're smarter, they're being implemented. And so we're going to be holding everyone accountable to that so that we can see this implementation. Thank you all, to the countries, to the technical participants, to the speakers. A huge thanks to Afrouz for organizing a lot of this behind the scenes and for moderating so nicely. And with that, I give you back 60 seconds of your day. Thank you very much and goodbye.